Now we'll be going, the 15th topic is retinopathy of prematurity. Mm. In this, see, first is the definition of ROP. Abnormal dilatation and proliferation of retinal vasculature is ROP, and the pathophysiology of ROP. Normally, retinal vasculature starts developing medially, and then it usually grows temporally. See, whole of the process of growth of retinal vasculature gets finished by 32 weeks of gestation. Therefore, ROP screen was always done after 32 weeks of gestation. See, during this process, when there is high oxygen exposure, see, it will lead to generation of oxygen free radicals, which will lead to release of lots and lots of vasoactive inflammatory mediators like VEGF. This VEGF causes abnormal dilatation and proliferation of retinal vasculature. Therefore, risk factor for ROP is high concentration of oxygen exposure. Next, we'll be going for what is known as ROP screening. ROP screening, it is actually done as per RBSK guidelines. It is Rashtriya Bala Swasthya Karyakramam. See, as per this, according to RBSK, we'll be going to screen 30 disorders, out of which retinopathy of prematurity is one of them. And we'll be going to screen ROP when the gestation is less than 30 to 34 weeks, and when the birth weight was less than 2 kgs, and when there are associated risk factors in the baby, like it can be a cyanosis, or it can be respiratory distress, or it can be hypoglycemia, or it can be sepsis, or it can be meningitis, or it can be respiratory distress syndrome. And next is neonatologist or the pediatrician usually thinks that the baby has a stormy course, that is requires a CPR or requires a blood transfusion or the ventilator support requirement baby, or when the baby was in shock, or when the baby was in hemorrhage, or when the baby was on inotropes. Then irrespective of the birth weight and the period of gestation, obviously we'll be going to do ROP screening. Yes, and now we'll be going finally the management. First, we'll be going for what is known as stage 1 of ROP. Obviously, it requires a follow-up, and stage 2 and stage 3 ROP obviously requires a cryotherapy, sedation, or the lesion. Nowadays, bevacizumab, which is anti-VEGF factor, is very important for the condition, and stage 4 and 5 obviously requires the surgical management. This is whole of ROP, wherein obviously we'll be going to discuss the 4 conditions.